All right, so we are recording, and we're here with Dr. Hagler,
Okay.
um, Jeremy Harper over here, and
Carson Harvey.
okay.
Okay. All right, you guys, good evening and thanks for joining us. And I am going to do a whirlwind tour through adolescent anxiety and depression. And thank you to Rose for sending me along some questions in advance because these are large topics. And I have to admit, I was really anxious thinking about how I was going to pare this down to go through. Um, so I'm Deb Hagler, and I'm a pediatrician over at Midcoast Hospital. And so what I'll do is I am going to just kick us off and just tee this up by saying that we all have mental health. And what we're going to talk about tonight are anxiety and depression, which are considered disorders of mood and really disorders of emotions. And we all have emotional well being. And this is a diagram from the American Psychological Association of our emotions. And you can see that they found lots of descriptive words to talk about our emotions, which I think as humans, some of us are very skilled at, but many of us actually are not. Um, but you can see the vast lexicon that they came up with here to describe our emotional world as human beings. So we all have this rich psyche of emotions, and we all have mental health, and we are all driven by our emotions. And I would just have you look at all just the circle in the middle for a minute. um, and if you pause for a second and look at those, and I'll just read them through: surprised, bad, fearful, angry, disgusted, sad, and happy. You can think to yourself how many of those emotional or those words even sort of feel good, and how many kind of catch you off guard or make you feel a little bad or sad, or as the words describe, sad. So our emotional life can trigger feelings in our body. They guide our behavior, and they will drive some of our thinking. So we're going to talk about that as we go through and discuss some of the treatments. But I'll also have you notice that there's a lot of things that you would consider negative feelings: stressed, tired, startled, confused, um, rejected, weak, threatened. We humans, for very strong biologic and evolutionary reasons, really are hardwired for many negative feelings and emotions. And in the end, they ended up being protective. But in our complicated world right now, um, having a lot of those around make life very challenging, particularly when you run through adolescence. So as you can see, we have this vast emotional world. We have a lexicon to describe it, um, that we are all learning about as we grow up. Very early on, we are very conditioned and start to talk about our emotions, but in many ways, we're conditioned um, to share and talk about good and happy feelings, and sort of um, I don't think we're as skilled um, and good about talking about hard and sad and troubling feelings. And we all know it's easier to be around somebody that's really happy and joyful all the time than it is to be around somebody that's sad and negative and depressed a lot. Um, so very much we're conditioned to not deal with some of these sad feelings, but those are part of our life. And having a lexicon and ways to cope with some negative emotions actually can be very preventative for um, troubling times as we get older. So I will just say that this sort of tees us off. We're all emotional beings, and this is why it's very human to have challenges with our mental health. So we all have mental health. We can all have challenges, and that's why I'm going to launch into some things that you will be probably surprised to hear are fairly common. And then the twist of the whole evening is that we're going to set this on the stage of normal development. And I love this slide. This is actually from an article on treatment of substance use disorders, but it translates into treatment of any mental health issue during during a period of very rapid and profound developmental changes, and that is adolescence. So adolescence begins with a very, very pronounced biological change, which is the development of maturation of that we can see obviously on the outside, which is changing secondary sexual characteristics as that part matures. But there's also a profound amount of change that goes on in the human brain during that time. So as we think about some of the changes that can go along with our emotional well-being during this time, and as parents and people that love adolescence, sometimes sorting out what is part of this normal font of development um, versus what might be problematic changes in mood can be really tough to sort out. So again, you have the right here on the left, you have the changes associated with puberty. And then the brain undergoes profound changes, judgment changes, the ability to reason, plan. Lots of things will change over the adolescent period. And then there's the whole idea of the maturation of who that young person is becoming and who they're going to be. Kids, become very self-aware during adolescence, very focused on the self for a while, um, and then very much about giving to the world. That self-focus can shift to what is my role in the world, what is my purpose in the world. This becomes very important in treatment of some of these mental health issues. And then, of course, there's the role and the place of the adolescent with their peer group, and the primary shift in the movement and the drive for autonomy away from the parents, the rise of the importance of um, self-control and self-efficacy and making their own decisions, and the importance of that peer group and their role in the peer group. And you can see that that shifts over the course of adolescence, but parents, you will see, are very, very important. So parents, if you're listening, you still play, you may not think it when they're sort of rolling their eyes at you at times, but you are still really critical, all throughout adolescence, even into young adulthood. You are a critical coach. So even though the peer group is taking increasing predominance in their daily life and what they want to do and who they want to spend time with, your opinion and your boundaries and what you do and you think matters greatly to them. So all of this is happening while while we are starting to see, very commonly, adolescence is a very common time for the emergence of mental health problems. So probably 50% of all mental illness will present in adolescence, and then again 75% will present by the time most people are in their mid 20s. And anxiety is probably the most common mental illness that we will see, or mental health diagnosis we will see in adolescents, with 1 in 3, the estimate is now, adolescents experiencing some form of an anxiety disorder. And I'm going to go through those. But I also want to step back and just remind parents and anyone else that is listening that anxiety is a normal human experience, and just talk about that a little bit. Anxiety is hardwired, that feeling of stress or apprehension, or that rise in that physiologic, that worry uh, around performance or certain tasks, or my presentation when I almost couldn't find the link, I got a little anxious. And so we feel anxiety in our body. um, these things are part of the normal human hardwiring, and it affects performance. But we are talking about stress and anxiety a lot of times with young people, and so I'm just going to remind people that some of this is normal. We were hardwired to have a little bit of anxiety as a species, as a race. without it, we wouldn't be cautious. We would throw caution to the wind and walk into every, you know, dark alley or dark doorway without thinking twice. This makes us stop and pause. It makes us plan. It makes us, um, think twice about doing risky things. So it is a normal part of the human experience, and this is a very old curve that talks about, how you clearly can be overwhelmed by your anxiety, and we're going to talk about that. But this is how our anxiety can affect our performance, and athletes know that there's a certain point, and performers know that at a certain point anxiety is a motivator. It makes us sort of, study that extra mile for that test, practice that extra time for a competition. It pushes us, it drives us. So at some point it is a useful human driver. It makes us move forward, it makes us push ourselves. But you can see by the curve, that too much of this obviously makes us non-functional, that fight flight, and then you freeze, so it impairs performance. So then I'm just going to move, because we're going to talk about treatments of this, but this is a little bit of prevention that is starting to get more and more, um, more and more discussion, and there are more and more interventions. But there's a lot of more research around our mindset, particularly around anxiety, and particularly how we talk to young people. So whether people, and this is again pure anxiety, not somebody that's been through trauma or had some type of severe traumatic experience, but the whole mindset around what that anxiety is. So when kids are overwhelmed or feeling really stressed or anxious around tests, there's significant amount of research around interventions to talking to youth around their mindset around that stress and what they're feeling in their body, and we're going to talk about that. But you feel anxiety in your body. There's a lot of symptomatic, um, uh, complaints that we hear, in the pediatricians or in the doctor's office about the symptoms of anxiety. So we feel it in our body. And whether people view that stress or that anxiety that they're feeling about their test or their performance as enhancing, oh, I'm a little worried about that. That's my body getting ready for a challenge, or, pushing me to get ready and be all set and perform, or we view it as debilitating, actually makes a huge difference. Research is starting to show in, and both the outcome of that performance, but in some of our overall satisfaction with work, job, school, test, over time. So there's a lot of research in something called stress reappraisal. So just, telling students before a big test that if they're feeling anxious, that's their body preparing them for a challenge. Don't be alarmed by feeling your heart going a little bit faster, sort of feeling a little bit tense. That's the body gearing up for a challenge. It's a normal response. Kids that got that advice versus kids that didn't get that advice actually tended to perform better on the test. And in businesses before big performances, employees that got advice like feeling again that stress and anxiety, that was their body gearing up for a challenge, not to, not to worry about that was them being ready to perform and perform well, versus, oh my gosh, you're so stressed out about the performance, it's terrible, blah blah blah. Just that reappraising of the role of the feeling of that stress, actually people did better, they felt better over the long haul. It decreased their anxiety and depression and increased their job satisfaction. So there's a lot more research into what type of intervention to reappraise that, and actually now they're really finding changes in biomarkers by this stress reappraisal, and that's different from mindfulness, which we're going to talk about, because there's a lot of good data about mindfulness, which actually dials down some of those physiologic stress responses, that also helps with stress management and the management of anxiety. So just changing your mind, and there's a nice little video that I put in the resources, um, really can help kids, adults, again, with some of the everyday stresses that we're all faced with, which are part of life, manage better and actually feel better over the long haul. So as I launch into that, now I'm going to talk a little bit about, some of the specific anxiety disorders and really focus on general anxiety and touch a little bit on social anxiety with a just a dash of panic disorder thrown in there, maybe a little bit of, and mention agoraphobia because it's a big fancy word that nobody really knows what it means, but I'll just touch on that. So the anxiety disorders really refer to the specific phobias, so fear of spiders, fear of um, dogs, fear of you can have a specific phobia, fear of needle. We see a lot in medicine, fear of needles. People have they are terrified of needles. Um, General anxiety is the one that's most common that we tend to all think about, where there's general worry or fear of bad things going to happen all the time, restlessness, hard settling the mind down. Social anxiety is fear of your performance or how you're going to be perceived in certain social situations. And that can be really hard to diagnose, but is fairly common in adolescence and gets missed a lot. Panic disorder is having panic attacks in certain situations, and agoraphobia is a big fancy word that gets confused a lot. People won't leave their house because they're afraid, but really, agoraphobia is avoidance of things that can cause panic. And so it can be um, it can be avoiding like public transportation if being on a bus can create a panicky or a panic situation for people. So it can be really actually complicated and very complicated to tease out and figure out if that's what's going on with an individual, because everything else can seem fairly okay, but there may be certain very specific things that there's avoidance because of this intense panic and fear. And you'll notice that this is not talking about PTSD or specific acute traumatic reaction or OCD. Those have those used to be all classified under the anxiety umbrella, and those have been reclassified. And we can have a separate discussion about some of those, but those now have been regrouped in a whole nother category, and rightly so, because the treatments are a bit, there's some overlaps in treatments, but there's definitely differences in treatments, and the symptoms there's some overlap in symptoms, but they've been reclassified. So I'm going to focus here because there's a lot of ground to cover and not much time. So for generalized anxiety, um, the core group of symptoms are excessive and irrational fears, a lot of trouble controlling worry, a restlessness. And because of that restlessness, a lot of times there's fatigue associated with it. And what I hear a lot is irritability. So um, really mood can change. Just little things can bother people. Um, Difficulty concentrating. And again, this is how a lot of times people end up in the physician's office, is because we feel anxiety in our body. Kids often complain of headaches, stomach aches, muscle pain. There's a lot of muscle pain because people will hold, everybody knows where they hold their tension when they get tense, but people get a lot of really bad muscle pain and muscle tension. And then one thing we start to see more and more, and this can go undiagnosed for a long time, because people and kids, and particularly um, adolescents that worry a lot about how they will be perceived or perceived among their peers or by their parents, will hold on to some of the irrational fears or their worries for themselves, because they worry about being a burden, or they worry about causing worry in somebody else, so they don't want to worry anybody else, so they hold on to their worry. So until something starts to either there's real avoidance, which the big thing that we also see a lot of is kids will eventually start avoiding school, but or there's a lot of trouble with headaches or stomach aches, or again aches and a lot of aches and pains, and sometimes it will get to the point of panic, where there are panic attacks which are terribly frightening, where you really feel like you're going to die. You can't breathe. Your heart is racing. Sometimes you're breathing. You can feel lightheaded and dizzy, like you're going to pass out. It's very, very, very frightening. And then generally, I will say one of the hallmarks of trouble that really makes us pay attention is sleep patterns, both in depression and anxiety. We often see disturbance of sleep. Kids with anxiety who are having trouble with worry and controlling worry, when it's time to settle down at night, will 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 have a great deal of trouble with sleep onset. So most people take 20 to 30 minutes to fall asleep. You will start to hear stories of it taking 1 to 2 to sometimes 3 hours before kids fall asleep, and they'll be up half the night. And one thing sometimes kids will start to do is distract themselves. And this is why sometimes it's really hard to tell in an adolescent. I'll hear stories of them up all night on the phone or playing video games, and I sometimes wonder, are they having trouble trying to control a worry or a fear, um, and they're distracting themselves playing a video game or watching TV or doing something to help push out those excessive fear or worry, and that's also contributing. It's this vicious cycle at night. But that always triggers something in my brain to help cue in that there may be something else going on. And then the other thing, in kids that are worrying a lot, particularly with social anxiety, they'll start to avoid events with friends, or attending social things, trying out for teams because they're worried. They will start to avoid circumstances with peers and friends, and being in social situations. Um, so that gives you sort of an idea. And so how do you tell this? I mean, because sometimes worrying a lot about school is what kids do all the time. How do you decide, um, with kids? How do you decide, is it a disorder, or is this just a phase they're going through? We hear a lot. And so there's a lot of things we look for, but definitely we look for duration. So to fulfill criteria for an one of the anxiety, for general anxiety disorder, for social anxiety disorder, for these disorders, it really needs to be there for at least 6 months. And honestly, by the time many, many, many kids come to attention, it's been there for a while. They've been struggling for a while. Um, and how often are they experiencing their symptoms? A lot of kids are experiencing these on a daily basis or most of the week. And how intense is their experience of that? And the intensity will start to show up, with things like the belly aches, the headaches. How much is it starting to affect their body? And then this slides into function. How much is it affecting their function? When they're having belly aches and they're not eating, that'll start to show up as weight loss in some kids. And some kids, and we'll talk about this with depression, but when it starts to affect functioning, um, that is when we really, will again start to, then it will slide into the classification that it is a problem. We would consider it in the classification of a disorder that we would want to intervene and treat. Um, and so, uh, paying attention to all of these cues, and again, sometimes it's very difficult and subtle to figure this out, and particularly with the anxiety disorders, anywhere, depending on whose series or data that you look at, 65 to 90% of kids may have something else going on with it. So kids often with ADHD can look like they have anxiety. Kids with ADHD can have both ADHD and anxiety. So there may be lots of complexity to what is going on, um, with a particular child. But if you're a parent and you're starting to notice changes in function, or you find that you're going into the doctor a lot for abdominal pain, and they've had an excessive amount of testing and workup, and there's no answer, and you're starting to see lots of other sort of subtle changes that may indicate that the child is avoiding different things, then you should really start to worry about anxiety. Uh, and maybe even before that, parents know best. Really, if a parent is um, is suspicious, that's a big indicator. If anxiety runs in the family, that's also a strong indicator. There are genetic links, so it tends to run in families. There are interventions for parents with young children. If a parent is particularly anxious, we can help early on with some parent interventions to decrease the likelihood that children will develop an anxiety disorder. And anxiety disorders, we know, it can be very successfully managed. And we also know that there's a good chance that kids will have episodic problems going through into early adulthood and into their young adult and throughout adult life. And again, it can flare and calm down, and but then be problematic. And so finding interventions and ways to cope with the anxiety, so it's not in charge of their life and running their life. Um, and so they are aware of the anxiety and understand it. And so they can do what they want to do and not have the anxiety sort of driving things and having them avoid things that they may really want to do, but really cannot push themselves beyond the anxiety. It is sort of a gift to give a child these coping skills, for to set them forward, for the rest of their life, knowing that there's a significant chance, up to 40% of people, maybe even higher depending on their circumstances, may have issues going forward. So what do we do for kids that are experiencing anxiety? We First of all, you go back to the basics. Restoring sleep or helping them restore sleep is huge. So a lot of times, i- i- um, you really have to address the anxiety, but keeping a regular sleep schedule, doing all the things to keep sleep hygiene good. Um, and what I find is some kids are so fatigued, they're having Red Bull at 4 o'clock in the afternoon so they can stay up and get their homework done, and then they're on the phone, and so you have to peel back all of that. um, Caffeine actually can make anxiety a lot worse, so seriously paying attention to that. Exercise really helps manage anxiety. um, so paying attention to just the things we know keeps everyone healthy, doing all those things are really, really, really important. And then, as I was discussing before, the mindset, reappraising what stress is in certain situations and how your body feels, is actually getting more and more research and attention. So that is helpful to help re-guide kids around that, and adults, honestly. Um, but mindfulness based approaches, and there's specific mindfulness based cognitive behavioral therapy, and we'll talk about cognitive behavioral therapy in a minute. But mindfulness based approaches um, really do many wonderful things in the treatment of anxiety. And they help, one, mitigate the way we feel anxiety in our body. So they drive down some of that sympathetic nervous system that is increasing the heart rate and our and blood pressure and muscle tension, and sort of kick in the other side of the nervous system to dial back that response, so you actually feel better. Your body just feels better. Your heart rate's going to slow down a little bit, your breathing is going to slow down a little bit, your muscles are going to slow down a little bit. And there's a wealth of information, there's a wealth of programs, but just simple, the Calm app, the Headspace app, just simple breathing, singing a song, things like that can activate the parasympathetic nervous system to, again, slow down the breathing, slow down the heart rate, decrease that muscle tension. And this is yoga does this, meditation does this. All those things actually really help. And there's some great resources out there now that really help people develop. It's helpful to do a practice, but even if you're in the moment and they tell you to take a deep breath, that is real. Like there's real physiology behind that to help you feel better in that moment and sort of give the brain a break for a second, but really dial down some of the physiology that just makes us feel that I've had too much caffeine, my heart feels like it's going to explode, and I just don't feel good. When you take that deep breath in for a second and let it out really slowly, or you take a deep breath in, count to 10, hold it, let it out, that actually will make you feel better for a minute and be able to sort of pause for a second and then go on. So the mindfulness based approaches definitely help. There's a mindfulness based cognitive behavioral therapy. Cognitive behavioral therapy really is a goal directed intervention that teaches us about our brain, how our brain is working, and the errors that we make every day in our thinking and assumptions about things. So, I just give you, and these things in our brains transpire. It connects our emotions, our behavior and our thinking and loops them all together and sort of untangles them so that we recognize what we're doing as an emotional response and then can help rejigger that. So I tend to try to there's a lot of people that worry about therapy, but cognitive behavioral therapy really is instructive. It teaches you a lot about the most complicated organ that we all have, which is our brain, and how it works and how it guides what we do in many of the choices and our behaviors every day. So, I usually try to give people a quick example of what you can learn about your brain, which is just fascinating. Um, to be able to have the time to understand it, that actually makes you feel better, and it changes things, and it makes people less anxious and feel sort of a bit more in control of just how they're moving through things. And it also teaches people to sort of be more flexible in how things are, that things aren't as catastrophic as sometimes our brain goes right away. Really, when you're very anxious, a lot of times um, we have something called catastrophic thinking. We go to the worst possible place that we can when something happens. And cognitive behavioral therapy teaches you skills to sort of recognize that tendency that can happen in a split second. Like you're supposed to meet a friend, your friend isn't there. So right away, sometimes, when depending on where your brain is, you'll assume, well, your friend doesn't like you. You've made the worst assumption there. That triggers a huge emotional cascade. And then you make behavioral decisions. Oh, I'm not going to talk to that friend anymore. I'm not going to answer their email because they don't like me anymore. That then drive behavior that then cause all sorts of other problems. So it cognitive behavioral therapy really teaches us about how our thinking and our thoughts, that split second decision that you make may not be real, or you may have sort of jumped to a conclusion, gone to a really bad place. And when you're really feeling anxious, and this is true with depression sometimes too, you make these what they call thought errors, and we teach people about them. And then how can you intervene and challenge some of these things? So that's what good cognitive behavioral therapy helps people with. And once you're more aware of that, you do start to feel better, and you're like, oh, I'm doing that again. Let me just rethink that. And then medication, actually, the combination of medication and cognitive behavioral therapy for teens has been shown in lots of randomized clinical trials, which is sort of the gold standard in evaluating interventions in medicine, to be actually more effective than either alone. So like 80% to 85% will do better and show recovery and even full remission much quicker with the combination of cognitive behavioral therapy and medications versus only 60 to 65%. So you get a 20% boost by doing both immediately together. Um, and we tend to use medication called the selective serotonin reuptake inhibitors in kids with anxiety, and they tend to help many kids. So medication, all these behavioral things, taking good care tends to help kids remit with anxiety symptoms if we get the diagnosis right. And again, on that backdrop of adolescence, maturity, again, worry and the confusion and the chance that there's multiple diagnosis, this can be really complicated to sort out. So if you're not certain, you always, this is one of my favorite things. Never worry alone. Just go get a friend, go consult someone, go talk to someone. It's always best to reach out to sort through some of these things if you're not sure. So that's a whirlwind tour through, oh my gosh, anxiety. Okay, and that took about a half an hour. So I'm going to talk a bit about depression, because depression and anxiety also tend to run together. And we know actually having anxiety for a long-standing bit of time is a risk factor for depression. And depression, again, we see depression in younger kids, but when you get to puberty and adolescence, it goes the prevalence of depression goes way up. And we know that most people who are going to experience an episode of depression during their lifetime, that will occur, their first episode will occur during adolescence. So, and depression for all of us as adults, as human beings, is actually a pretty common and debilitating illness. If you look globally, after colds and diarrhea all over worldwide, depression is probably the most, after those two things, the most debilitating illness of mankind. So this again, the most common time for it to present is in adolescence. And if you like at any point during a year, so the year prevalence, probably about anywhere from 7 to 8% of kids, and who knows what COVID has done. And what we have is a rough proxy, so it's hard to really sort these numbers completely out, because our rough proxy of this for Maine it is the MIHAS data, the Maine Integrated Youth Health Survey data. And we ask a question on that survey is, um, have you felt sad or hopeless every day for more than 2 weeks in a row? I think that I'm probably getting a little bit of the exact wording of that question incorrect, but that is our proxy for if kids are feeling depressed. Um, and in Saginaw County for high school kids, our rate is 36% based on the 2019 data. So we don't know what COVID has done to that, um, those numbers, but we know that a fair amount of kids, and the numbers in adolescence, actually the numbers of youth experiencing or feeling depressed, have doubled over the last decade. So this is a problem that has been on the rise, um, in youth, and we're definitely worried about it because and anxiety can be associated with suicide too, but depression is the thing that we worry about, with the strongest association with youth suicide. So the symptoms of depression, it can look a lot like other things, and it certainly overlaps with anxiety, but key features are feeling sad or hopeless, so that depressed sad mood. And then on this graphic, the reference to anhedonia just means the lack of joy um, or getting pleasure from things that you used to have fun or enjoy. And that's something really that makes it very different from anxiety. So kids who are anxious can still go out, they can still manage at some point to have fun or engage and do fun things with people. People who are depressed really have a hard time having fun or doing things that they really like to do. So this is something, if parents are worried, and are not sure. And again, we'll just look at that adolescent developmental trajectory, because kids tend to disengage from their parents, and parents sometimes are not sure if their kids are like having fun or doing fun things. But then, like, a friend shows up and then they're off, going hanging out with their friend, doing fun things with their friend, but like, they're not they're just not spending time or engaging that much with their family, but with their friend they're doing a ton of fun things. So sometimes it's really hard to judge like what the parent is seeing with the family versus what they're doing with their friends. But when you start to see a youth drop out of their friend, when you see a kid who is like an avid guitar player put down that guitar, and it's not just like, I'm done my guitar now, I think I'm going to move on to the tuba. When it's not that anymore, and they're just switching up, they're trying on new things, they're trying on that new sense of self, which kids will often experiment with during adolescence. Like one week it's pink hair, next week it's purple hair. Like when it's not, I'm just trying things on, but it's I've quit and none of this is giving me any joy anymore. That's anhedonia. That is something that we really worry a lot about. That's a, that's one of the core features of depression. You start to hear kids feeling really this, what we hear a lot of, they have low self-esteem, they feel guilty about everything, they feel worthless. And then you hear from parents a lot, and parents sometimes can really see this more than the individual who's experiencing it is what I see from teens is except they can verbalize very clearly, I don't have the motivation to do anything, I don't feel like doing anything, I don't want to get out of bed. Kids with depression tend to either sleep all the time or else they're not sleeping at all. um, and then we often will see when kids are very severely depressed, big changes in weight. Either they're eating a lot or they're eating nothing at all. So that will be something that we hear from kids and parents a lot as well. And then of course there's a risk of suicide. And this is something we talk with youth about. There will be sort of this transient, this amotivational, like I just don't want to be here anymore, to deep dark thoughts of suicide with plans. And kids will discuss it. Parents should not be afraid to ask about this. um, and if you're not sure or you're uncomfortable or there's something there, you should definitely reach out to the crisis line, to a professional, to let them guide the discussion with you. Talking about suicide does not encourage it. It actually helps open the discussion, and it can be life-saving. There are some people that just will hold those cards very close to them and they won't discuss it. Those are the people we worry about the most. But having the discussion does not bring it out. So parents should not be worried to have the discussion. We certainly recommend in households where there's worry about suicide or depression that if there are firearms or something like that, that they are stored appropriately, that they are locked up. Because we know in many cases of suicide, it's impulsive. There are good studies to demonstrate that up to 40% of people thought about it for less than 20 minutes, sometimes even 5 minutes. So if you have that impulsive thought, you're at that deep low, there's a firearm handy, that is a deadly situation. So again, this is a life-saving intervention that families sometimes aren't aware of, and they should not be afraid to talk about it, and certainly should not, something that is as lethal as a firearm should be stored securely or removed from the household. So depression is tricky in the setting of an adolescent. Again, they are they are maturing, they are more self-aware, but sometimes it's very hard to be um, understand that you're starting to get, you're in that fog of depression. You have symptoms that look like something else, but you are wanting to be independent, so you're pulling away from your family, you're with your peer group, you're interacting less with your family. A lot of kids will want to spend time by themselves in their room. So is that isolating, withdrawing, not engaging as much with the family? Sometimes that can be hard for parents to judge. And the other key thing that I forgot to put that on the list is, with people who are depressed, they often have real irritability. I often hear that people are walking around eggshells in the house because the mood can shift. Little things annoy them very easily. So there's tiptoeing around the irritability of the person that is depressed in the household, because again, little things will set them off. Sometimes there's increased arguing in the household, and once people recognize that this is not the normal, and it's really, again, sometimes challenging to figure out that this is not the normal, um, then then even having a name for what's going on actually can make things start to feel better in the house and make things start to function a little bit better. um, so is it a disorder? So it again, duration. So the symptoms for depression are usually, if they're longer than 2 weeks, then that flips you into the category that this is a problem. And again, experiencing these lows daily or every close to every day for 2 weeks will qualify, will put this into more of a disorder. But we start to worry when we see little bits and pieces of this, starting to accumulate, and how intense. So we will classify depression as mild, moderate, and severe, and that depends on how many of those symptoms. And then really we look at function to know, how abruptly and how much we need to intervene. When you're severely depressed, it is very hard to function. In the worst circumstances, people are not motivated enough to get up. Either they're sleeping all day, so they're missing school, they're not able to do schoolwork, they can't focus, they're getting behind, their grades are falling, they're not interacting with friends. Some people are not showering, they're not getting out of bed, they're not getting dressed. So you can see how function is really severely affected. um, so treatment, and oh, I forgot to mention sleep. Sorry, sleep is a big, um, it is highly affected, usually both with anxiety and depression. Restoring sleep, so addressing good sleep hygiene, again, which kids and families sometimes, but kids themselves, they're often, either they're sleeping too much, or in the case that they're not sleeping, their sleep cycle is very disturbed because they're not sleeping at night. So they're sleeping a lot during the day, then they're doing things to try to stay awake later in the day. So restoring somewhat of a normal sleep cycle so you can help them restore functioning, um, it is really paramount. And sometimes that actually takes medication, but restoring sleep helps people function and start to feel better. When you've worked really hard and you've pulled an all-nighter, that you don't feel good the next day. So sleep is hugely important to mood. So attending to sleep, making sure the cat's not jumping on your face, making sure the room is dark, making sure it's quiet, making sure you have not had caffeine or caffeinated beverages, keeping cell phones and computers, which are really hard, um, but trying to keep those out of the sleep sort of equation, turning off the computers and getting off of that stuff, an hour to an hour and a half before bed really does make a difference. And it's hard to institute that, but slow and steady, um, can make a huge difference. And again, sometimes really when people are severely depressed, we will use some medication to help restore the sleep. Treating the depression usually will help restore sleep, but sometimes, again, you need to do both at the same time. And then using a combination of medication and psychotherapy. Sometimes with very mild depression, we will just use the psychotherapies to help, and that can be enough. Um, for moderate to severe depression, the recommendation is to use both. You will get better response and recovery with that. With depression, um, we know that there's a significant risk of recurrence, and so we know people recover, but so we want to help kids. The earlier you present, so again, depression tends to be a life course illness for people. The earlier you present, actually, the better you tend to do over the course of your life. um, and the better people tend to respond to therapies. Most people start to improve after 3 to 6 months of treatment, and but again, people can take time to respond to medication. The first medication may not work. The psychotherapies for mild depression tend to be similar to the psychotherapies for anxiety, in that cognitive behavioral therapy tends to be one of the first recommendation. There are other psychotherapies, um, that are helpful for depression. Interpersonal psychotherapy, which uses the relationship between the therapist and the patient, is helpful. And then there's some other psychotherapies that are being studied, in adolescents, that give them tools for coping with the sadness and some of the negative emotions, um, that have been studied and have been found to be helpful. More and more forms of In adults, it's called acceptance and commitment therapy, but accepting some of these harder emotions and sort of learning to work through them are starting to show more evidence-based um, for kids, and so there are forms of those. But the most commonly used, I would say, is cognitive behavioral therapies. And again, the same medications that we use to treat anxiety are first line for depression in adolescents. So we tend to use the selective serotonin reuptake inhibitors, and I should just say names that people will know are fluoxetine, sertraline. Um, those are some of the more common ones that we use. Citalopam, those are all common. And then support, uh, offering academic support while kids are recovering and we're adjusting medication it is critical. If you think about, we make accommodations for concussion and some of the brain fog that kids are going through uh, when they have concussion. Treating kids for both anxiety and moderate to severe depression, even milder, all of these mental illnesses affect cognitive functioning. So it can be really challenging to do schoolwork, especially for managing medication and adjusting medicines. It can be really hard to focus and concentrate on particular cognitive tasks. So working to help that child meet school expectations, but in a slower sort of paced out way while they recover. These are challenging illnesses to manage, but certainly I see amazingly resilient kids and families when they come together, support, give time for the therapies to do their thing. The some of the just strongest and most amazing things I know. And then we have just a few minutes left. So I want to specifically, because there were specific questions about um, our LGBTQ population here. And, we know from data that they are at higher risk for problems with anxiety and depression. And I want to specifically try to address a little bit of that. We know um, a substantial risk for that comes from family support. So there's a huge body, excuse me, of research. Adolescence, as you saw, is a time. So you were born a certain biologic sex, and gender is a social construct. We start that, with the pink and the blue blanket the minute you pop into the nursery, but many kids are not comfortable with what we throw on them, and that can happen really very early on, that they're not comfortable with the gender that society has decided to, because it wasn't their decision, it was our decision. And so kids will struggle with that starting early, but puberty really can force the issue for kids. And when kids are struggling with what that gender identity is going to be, who they're going to love, what they're going to love, when they don't receive, that can, one, create a lot of anxiety. Still, things have changed a lot, particularly over my lifespan and acceptance. But we know these things are fluid. They are not firmly rooted in biology. They are very fluid, and when both the family and when society supports people that are struggling with these issues, people do better. When it's a supporting, accepting community, and particularly when the nuclear family is supportive, we know that anxiety and depression, substance use, and suicide attempts over the course of that person's life decrease. So this is just a graph um, that I pulled from some very groundbreaking research that SAMHSA has published a lot of good resources for families, for youth that are questioning and sort of going through some of this. Who am I? You saw the sense of self graph through adolescence, but this is from a brochure from SAMHSA that I think I listed in the references, and I'll just give you the little slides with the resources, but of what happens to a person over the course of their lifetime when, during adolescence, even if the family doesn't quite understand what's going on, when they're supportive and accepted of that youth, and they're supportive and accepted of the youth and their struggle, saying, I don't I don't know what's going on. I don't know if I even understand it, but I love you and I'm going to be there with you. I'm going to learn with you. We'll learn together. We're going to take this journey together because I unconditionally love you as a parent. I brought you into this world. You're mine. We're in this together. And if that, you don't need to say that. You could say that. But if they know that that's the environment that they're in, and some parents can't quite get there, but if you can signal some sort of support, even little bits, and there's lots of work with families to meet them wherever they are, but we know that when both the family and then the community is supportive, kids over the course of their lifetime tend to do better. So this is data from a very famous study in San Francisco of life course. So when the family was extremely accepting, 92% of during adolescence, this is sort of the 92% of those young adults and adults felt happier. When they were very accepting, 77% felt happier. So when they were a little accepting, 60% felt happier. And when they weren't accepting at all, only about a third felt happier. So again, you can't help your feelings as a parent, and a lot of parents come and react to kids coming or talking to them about coming out with shock and maybe even fear, just because they're so worried. They love their kids and they're so worried about acceptance and what may happen to their youth. And once sort of that can be conveyed or expressed, or there's lots of work to do. um, there's great support, but if the child knows they're still loved and accepted, that goes a huge way. So what we know is that the supportive environment is critical, and little things like showing kids, positive role models, um, that meet the gender they think the gender that they're adopting, are huge. But they're great resources for families. It's not necessary for everyone to go to therapy right away, but it's necessary to educate and get support. So one of the best resources we have in Maine, and we're really lucky, is Out Maine. And there's a great deal of work and wonderful resources for families and for kids um, that they have available. So I would just say we certainly know that kids are that adolescence is the time when kids really struggle with gender and sexual identity, and they are at much higher risk than than kids that adopt a cisgender. Um, but when we support them and we sort of take the journey with them, even though we may not fully be prepared as parents, then those kids do better. And um, and then it's 2 minutes to 6, and I don't know if I have any time for questions. So I'll just leave it with that and move to, I just left a couple of the crisis numbers, and then there's a lot of really good resources out there. The Child Mind Institute, the Clay Center at Mass General from their Department of Psychiatry. This is the website for the child and adolescent. ACAP is the Adolescent and Child Psychiatry Organization. This is from healthychildren.org, which is the American Academy of Pediatrics. And then this is a great explanation of some of the management of stress. And then this is the National Gay and Lesbian Hotline. And then NAMI Maine, of course, is a great resource here in Maine for all things mental health. And I will just say, wow. And then these are some, academic, these are some great articles about mental health. And this is the SAMHSA brochure for supporting families, how families support LGBTQ youth. And I will just say thank you. And man, this went fast, and there's a lot to talk about. But if I don't know if there's questions in the chat, but there we go.
No, that really did go fast. I feel like it was 5:20 1 minute and 5:51 the next. But that was, you covered a lot. That felt to me pretty comprehensive.
Yes.
There's a lot we could talk about.
Yeah.
So I'll just leave it at that. I don't, I think this is a webinar, isn't it? It's not a.
Right, but I will be able to share this this file that this
Okay.
is saved as, and if I don't have the link to this PowerPoint, I can email you, and then I can include that when we email the parents at the end of the week.
Yeah, I can, I can email, if you guys email me, or I can email Rose the link to the PowerPoint or the whole PowerPoint as a PDF. So you guys have that.
Okay, yeah.
And I think we did want to mention, as far as if parents do have further questions, to feel free to reach out to us. Rose, I think her email, and we can try to get those answered.
Yes, absolutely. Okay.
Yeah, thank you so much for your time, for everything. This was yeah, really helpful.
Okie doke. All right,
All of
you
us
guys.
who deal with these kids.
Yeah, no, thank you for giving me the chance. And yeah, we could spend a whole hour diving into just depression. So, or a whole hour talking about social anxiety, or a whole hour just focusing on panic. So
yeah,
there we go.
Okay. Well, thank you so much again for all your time and everything.
All right, you guys have a good night.
Thanks.
Thank
All
you.
right, you too. Bye.
Bye.